And we've got some major changes coming to mental health services in Lewis and Clark County, as an important provider says it plans to end its services in the county. MTN's Jonathan Ambarian looks at what led to the change and what the next steps will be.
For about 5 years, Western Montana Mental Health Center has provided a variety of services in Lewis and Clark County. That includes behavioral health specialists in the county detention center and a crisis response team that is called out to provide mental health assistance in emergency situations, as well as the Our Place drop-in center and the Journey Home Crisis Stabilization Unit. Last month, Lewis and Clark County leaders announced changes to those services. They decided to hire specialists for the detention center directly instead of continuing Western's contract.
As we are tracking data, which is imperative to the work that we're doing, we know that if we have those positions in-house, we'll have better access to the data, and we can have requirements on the staff that we couldn't have by having it as a contracted.
At the same time, they opened up a request for proposals for the contract for the crisis response team. County leaders said they had a responsibility to make it an open process.
We need to ensure that we're being fair to our entire community and being really looking at what provider can come in and provide the best services for our community.
Western leaders said that announcement was concerning for their organization. They say they didn't want to keep operating the Journey Home if there was a chance they wouldn't run the crisis response team.
There was a risk through an open RFP process that we would not have clinical input into those individuals who were admitted into that facility. That's operationally would have been extremely challenging and created risk for the organization.
Western decided not to bid in the RFP. Leaders say they then reevaluated their entire operation in Lewis and Clark County and decided they would stop providing direct services there.
We feel now, looking at the non-renewal of these agreements, that we're not in a position to fully execute and achieve our mission in Lewis and Clark County with such a limited scope of service.
Both the county and Western say they're working with other local providers to ensure there's a plan to keep those services covered.
We're certainly always sad to see a provider leave. What we have seen in Western's notice to leave the county is so many providers stepping up.
We understand that the service that we were providing was very much needed in this community, and we hope to work with other providers and work with the county to create a transition plan to limit any disruption in service.
In Helena, Jonathan Ambarian, MTN News.
Western Montana Mental Health currently has 22 employees working in Lewis and Clark County, and leaders say they're working to find other positions in the organization for some of them and positions with other providers in Lewis and Clark County for the rest.